Why have I chosen to do it now? I'm this side of 50, and I'm actually getting married in the spring, so I'm looking forward to having a little fresh for that exciting event in my life. And Dr. Buonassisi and I have a good professional relationship. He actually did my upper eyes for me a couple of years ago, and I'm really happy with the results. At the time, I did speak to him about my lower eyelids, but he suggested that I wait. So I'm ready now. I'm looking forward to having a conversation with him today about that. I totally trust him. He's an expert in his field as a facial cosmetic surgeon, so yeah, that's why I chose him.
Now we've already taken your photos, so what we're going to do is just head over to the exam room. Katie is an excellent candidate for lower lid blepharoplasty. She's otherwise healthy, she doesn't take any medications, and she has very realistic expectations about what we can achieve. She's not looking for perfection, she just wants an improvement. So Katie, I'm seeing you today about your lower lids. Now we did upper eyelid surgery for you a couple of years ago, and we talked at that time about potentially doing something for your lower lids in the future. What has changed now that you're back to see me?
I think overall, when I look in the mirror, I just see a really tired person, and that's not how I feel inside.
Okay. We talked about this before when I did your upper lid surgery for you, and I thought we should wait a little while before doing the lowers, but I do see now that you do have some puffiness of your lower lids, and I think that's partly contributing to it. I'll show you with a mirror what happens as part of the aging process and also as a result of sun exposure. What's happening to you is some of the fat in your lower lid is starting to bulge forward, and we can actually see it sort of bulging the skin forward. And it's not because you've had a change in your body weight, it's just that that fat is not being held back as tightly as it was when you were younger. Now, keeping your head where it is, just look at the ceiling with your eyes. What that does is it pushes that fat forward and accentuates that. I'll show you that in some photos later. If we can remove some of that fat, then that will flatten your lower lid. Now you've also got a groove underneath, and that groove is formed by attachments of your lower lid muscles to the underlying bone. So I can detach those attachments as well. And that will allow me to not only tighten the lid, but also the skin down below as well. And that makes it easier to camouflage that transition zone that you have between the lower lid and the cheek. Now that would be done by removing some of the skin of the lower lid, just underneath the lash line, tightening the muscle, and also tightening the corner of your eye as well to make sure it stays strong. In terms of the fine lines and wrinkles that you have, probably that's best treated with chemical resurfacing for the lower lid and Botox for the corners. And I think overall that would give you a very nice result. So in summary, what we're going to do is a lower lid blepharoplasty. We'll make a small incision just underneath the lash line. That'll allow me to elevate the skin and muscles so that I can remove some of this fat. And then more importantly, I can elevate and detach that tear trough. That's going to allow a nice smooth transition between the lower lid and the cheek. Once that's done, the incisions will be closed with dissolvable stitches, and I'm going to do something called a canthopexy, and that's going to allow me to just gently strengthen the lower lid so that it stays in good position in the post-op period. So she should recover quite easily from this over a period of about a week. She'll have a little bit of bruising, but that'll be easy to camouflage. And I think overall she's a very good candidate for this. So when we get started, I'm going to make some markings in the lower lids to identify where the incision lines will be placed, and then I'm going to put some local anesthetic into the eyelid skin so that Katie won't feel a thing. This is going to be very routine, and I think Katie's going to do really well. So we're all done with Katie's surgery. She did really well. So she's going to stay here for a couple of hours now, and then we're going to get her ride to come and pick her up or take her home. I'm not expecting her to really have any discomfort, but she'll take some Tylenol if she needs to. Otherwise, just some light ice packs to the eyes for tonight and tomorrow, and then a little bit of polysporin to the incision lines. So we'll see her in a week, and then we'll see her again in about 2 months for her final results. And I'm really looking forward to seeing her then, because I think she's going to look just great.